So I adopted Carlos about 10 years ago. I decided I wanted to adopt a pet, and I decided I would get a cat. I love dogs too. I just picked a cat, and I went to a rescue shelter, and I was in one of the rooms. They had big open rooms where there were lots of pets hanging out in rooms, and so I walked into this room. There was climbing structures and food everywhere and tons of animals running around. And I walked over to a climbing structure, and this cat leapt off of the top of the climbing structure and leapt right into my arms. So I thought, obviously I have to adopt this pet. At the end of January, Carlos started to get sick. He was vomiting and was very lethargic, and after a few days I realized I needed to take him in because it wasn't getting any better. So we came into the emergency veterinary services they have here, and we thought maybe he had eaten something was obstructing his stomach or his intestines. They did blood tests and x-rays and ultimately an ultrasound, determined that there wasn't an obstruction, and they transferred the care over to Dr. Levine, who determined that he had intestinal lymphoma.
We did an abdominal ultrasound, and we found that he had an intestinal mass as well as some enlarged lymph nodes in the abdomen. And so we were able to aspirate, stick a needle in those lymph nodes and aspirate cells to look at under the microscope. Carlos was diagnosed with lymphoma at the end of January of 2015.
And so once they determined that, they transferred the care from the emergency veterinary side to the internal medicine side, so the Asheville veterinary specialist side.
Carlos is actually doing fabulously. He, with his chemo, he tolerates it very well. He's had minimal side effects. He's really been, he's kind of coasted through without any issues.
He's doing really well. You know, I'm looking forward to when we can stop, just for lots of different reasons, but it's been, I would say, significantly better than I expected. Part of it has been his reaction to it has been better than I expected, but also the overall process has been better. It's nice to come in every week or every other week to a place where I feel like they like him and they're friendly, and it's just been a better experience overall, I think, for both he and myself.
Every week when he comes in for his chemotherapy, we draw blood for his CBC, a complete blood count to check his white blood cell count, make sure he's not anemic and that his platelets are okay. And we're able to, again, send that downstairs to the lab and have those results very quickly, under 10 minutes usually. It's very nice. They have great capabilities.
I definitely recommend R.E.A.C.H and Asheville Veterinary Specialist. When I brought my cat in for the emergency side, they saw him really quickly, they asked lots of questions, they were very helpful. They regularly called me with updates. They let me come in and visit him because he was here for 2 nights. So that was really nice to be able to come in and see him, and the service was great and the doctors were great. Once he was transferred over to the Asheville Veterinary Specialist side, again, I feel like he's received the best care possible. The people here really seem to like animals, which helps. They say hello to my pet by name when I bring him in every week. You know, they know who I am. They're very friendly. It's nice to know when you're going through something like this. You know, your cat has cancer. It's nice to know that the people who are taking care of them actually like animals and like your pet and want the best for them. So I definitely recommend Dr. Levine, R.E.A.C.H, and A.V.S.